I need my guitar. This guitar.
Well, welcome to the National Fibromyalgia Chronic Pain Association with the Utah Fibromyalgia Association's 4th annual Walk to Cure FM. That stands for Campaign for Understanding, Research, and Education of Fibromyalgia. We're very excited to have you here. We know that we could have more people here with us, but that actually represents why we're here having this walk today, because fibromyalgia is a central nervous system illness that exhibits with pain, cognitive difficulties, sleep difficulties, and actually is very difficult for people to be involved in outdoor and social activities. So we're glad that we have the people who are here with us today. We appreciate your support, and we are very excited to have this as our national event.
Somewhere over the rainbow, skies are blue.
So thank you very much for being here, and let's get going on our walk, and then we'll rejoin together. Thank you.
Someday I wish upon a star, wake up where the clouds are far behind me, where troubles melt like lemon drops, high above the chimney tops. That's where you'll find me, oh somewhere over the rainbow, bluebirds fly, and the dream that you dare to, why, oh why can't I see trees of green and red roses too, and I see them bloom, and I think of you, and I think to myself, what a wonderful world. And I hear babies cry, and I watch them grow, and they'll learn much more than we'll know. And I think to myself, what a wonderful world. Oh, somewhere over the rainbow, bluebirds fly.
Well, let me ask another question. Is there any test that a doctor can do that will diagnose fibromyalgia? Like a blood test or anything like that? So no blood tests, and they've actually done lots of studies on this. They've gone and they've looked at biopsy people's joints and their cartilage and their muscles and their tendons and everything, looking for something different between people with fibromyalgia and people who don't have fibromyalgia. And they can't find anything in the joints or in the tissues that will explain why you have these things going on. Okay? So let's talk about what they do know about fibromyalgia. Why do you have the pain? So I'm going to erase this part off. And scientists are actually looking at this, trying to figure out how this happens. And I think it's important for you all to understand how the pain gets from your body to your brain. So I'm going to give you a little anatomy lesson. It's not really an anatomy lesson, it's a neuron lesson. So you have different kinds of nerves in your tissues, and some of them pick up pain. And so here's a pain neuron, maybe out in your joint or your back or your muscles or someplace. And it goes into your spinal cord, and when it gets there, it has to form a synapse, because this is a peripheral nerve. It doesn't go all the way to your brain directly. It goes into your spinal cord, and it has to connect with another nerve that then goes up a tract with a bunch of nerves up to your brain called the spinal thalamic tract. And so here's your brain up here, and it's got the little wiggly things on it on the surface. So it has to get from here, from your tissue up to your brain, and it has to get through your spinal cord. It has to actually have a chemical. There's a little chemical release right here. When this pain fiber gets triggered, there's a chemical release here, and then the nerve message goes up your spinal cord to your brain. And what they've found is that people with fibromyalgia have a different perception of pain than people who don't. And the way they've done this is they've done pressure or pain stimulation on people's fingers or temperature sensation. And people with fibromyalgia pick up the pain a lot earlier or feel the pain or notice the pain a lot earlier than people who don't have it. So you've got an issue here with with information going to your spinal cord and making it to your brain. People who don't have fibromyalgia, the message never gets there. Okay, so you guys are getting all sorts of pain information that people who don't have this problem don't get. It's kind of strange, isn't it? So we're not exactly sure about exactly what causes this, but it has to do with neurotransmitters. One's called norepinephrine, and they've been able to put people on medications that affect this transmission of information right here. And some of you may have been on some of these medications. Okay, so let's talk about how medications work, because there's lots of things that work for fibromyalgia, but they all work a little bit differently. So I want to talk about them just a little bit. Some of you may have been on a medication called Neurontin or Lyrica, right? Okay, well, Lyrica doesn't affect this part of the transmission. It affects the peripheral nerve. And so people who have neuropathy, like people who have diabetic neuropathy and their nerves are damaged, their feet or their nerves are sometimes sending too much pain information, sometimes not enough. But basically, Neurontin or gabapentin affects transmission in this neuron right here. Okay, and Lyrica, maybe some of you have been on Lyrica before. Lyrica also affects transmission of pain from here to here, but it doesn't affect things up the spinal cord. Okay, there's another group of medications called Tricyclic Antidepressants, which is Elavil. I don't know if you guys have been on Pamelor. There's a bunch of other ones, but basically, this affects norepinephrine levels in the central nervous system and causes, decreases the amount of pain that gets transmitted up the spinal cord. So Elavil might be a good medication for some people, but it has lots of side effects. Anybody been on Elavil before? Okay, Elavil has lots of side effects. I can just tell you that right now. I'm not going to go into all that. But, so now there's other things that maybe some of you have tried. Anybody tried any opioids or like hydrocodone or Tylenol 3 or things like that? Okay, those block the transmission up the spinal cord into the brain, the central nervous system part of the pain perception. And they work, but the trouble is you build tolerance with time, and then you have to have higher and higher doses to get the same effect. And so people sometimes have problems with needing higher doses to get the same relief, and so people don't generally recommend that you use opioids because it's not a good long-term solution. Okay? All right. Any questions about what I've talked about so far? You guys? Questions? Okay, so that's sort of the medication stuff that people use. TCAs, Lyrica, and Neurontin. There's other medications that you probably shouldn't use, but I'm not going to go into all those. These are things that have been shown to be effective in long-term use for people who have this condition. But this is just medicines. There's lots of other things you need to think about besides drugs to take care of this, okay? The question is, let's go back to why does this happen in the first place? Why do people have this problem? And I'm not sure that we know all the answers, at least I certainly don't. But people are working on this right now in research institutions. But what we do know is that sometimes there's things that trigger this. We know that there's probably a genetic component to it. We know that that sometimes there's traumas in people's lives. What kind of traumas do you think could trigger fibromyalgia? Surgery, absolutely. Surgery, surgery. What else? Automobile accidents, motor vehicle accidents can set this off.
Childhood traumas.
Childhood traumas, excellent. Okay, people who have been abused as children or have had some horrible thing happen to them, or they saw something that was really awful, or just, you know, so psychological or physical trauma of childhood or growing up can sometimes cause this. So I'm just going to put that down because that. Okay, and what else do you think could cause this? What happens if you take a person? They've done this study too. You take a group of people who don't have fibromyalgia and you wake them up or you make enough noise that they don't sleep at night. You wake them up every 15 minutes or every 20 minutes or every 30 minutes. Guess what they get? After about 3 days, they have the exact same symptoms that people with fibromyalgia have. Okay, so those kinds of studies have been done. So if you have something that affects your sleep in a negative way, that could also kind of trigger this. Okay, so sleep problems, whatever they are. Think about, this is what I think about. When I think about fibromyalgia, I think about a bear hibernating in a cave. Because we all think that bears, when they hibernate, they go into their cave or in their little den and they hang out all winter long and they sleep for 3 months. And there's nothing further from the truth. When an animal's hibernating, they are basically in a stressed situation because there's no food to eat. And if they fall asleep, they might get eaten by some other animal, right? So animals that hibernate are always kind of, if they look like they're asleep, they're just barely asleep, and they're just waiting for the next disaster to come along or somebody to try and chew on their leg or something like that. So they're kind of in this hyper alert, restless sleep. They're not sitting there snoring, dreaming about hamburgers or hot dogs in the springtime. They're sitting there, psychologically they're sitting there worried about, what's going to happen to me, okay? And so I don't know if bears actually worry or not, but physiologically that's what their bodies do. And so what does a bear do when he's inside the cave? He sits there and tosses and turns for 3 months and watches for watches for other animals come in the cave to eat him. So think about sleep problems and stress. Okay? So if you've got things that are stressing you out in your life, chances are you're going to have a harder time managing your fibromyalgia. Now, when people don't sleep for whatever reason, all sorts of other things happen too. I mean, they're more susceptible to depression and mental illness. They're more susceptible to all sorts of problems when they're not sleeping well. So I can't stress enough, if you guys have sleep problems, work on improving your sleep hygiene. That's really important. Okay? All right. Anything else that can maybe trigger this? I think this is a pretty good list, but things along these traumas, can certainly cause this, because anytime you're in a situation of stress, you're going to have a higher likelihood of not sleeping well and not doing well in general, and sitting there at nighttime worried about what's going to happen. Okay? Now, I have been in that stressful situation. And what I noticed, when you're stressed out and you're lying in bed at nighttime trying to sleep and you're not sleeping, I've noticed that all my muscles in my neck, all my muscles in my back, all my muscles in my legs are all tight. They're all way, way tight. And this happened to me when I was an intern in medical school. After medical school, I was really scared to death. I was stressed out big time because I was pretty sure that all my patients who were dying because I was not doing a good job, okay? I've since learned that probably that's not the case, because there's a lot of other people helping me out and we were taking care of really sick people, but I went home at night time and I lay awake at night worried about my patients in the hospital. And I honestly did not sleep for about the first 2 or 3 months. I just lay awake for hours and hours and hours thinking and worrying, and my muscles were all tight and I was getting fatigued and my brain wouldn't work right. You guys talk about, people with fibromyalgia talk about brain fog. I understand what that feels like, because after a while your brain really doesn't work very well and you can't really think. And so here I am, an intern. It's been about 2 months into my internship, and I'm going into this descent, into this hibernation kind of thing, where I'm not sleeping well, I'm feeling extremely fatigued, I hurt, I don't feel good. And what happened was I luckily had a mentor, a professor, who was board certified in both internal medicine, which was what I was studying, and psychiatry. And what he did is he taught me how to relax. And so he basically made a little tape, a little cassette tape, and I played it every night at my bedside for 17 minutes. It's a 17-minute long tape. And he went through these little exercises where you tightened all your muscles up and you visualized things that were pleasant, and then you practiced relaxing. And it was amazing how all these muscles that were really tight all of a sudden stopped being so tight. And I actually could go to bed after 17 minutes. I didn't take any pills. I just did these exercises and I went to bed, and my life started to get a lot better after that. And my patients, I think, did better too, but I'm not sure about that. Anyway, so that's kind of something that is really important, is this whole sleep thing. What other things do you think are important as far as treating and taking care of your fibromyalgia? Because sleep is really important, but there's some other things that are extremely important besides sleep.
Nutrition.
Nutrition? Okay, tell us about that. What about nutrition?
Well, I think the healthier the diet, the better off a person is in general.
Okay, I think that's really important. A couple of studies have been done on this. You know, first off, there's some things about nutrition that you probably shouldn't be using if you've got fibromyalgia. You probably shouldn't be drinking caffeine. Okay, now why shouldn't you drink caffeine? Because it interferes with your sleep. Okay, I mean, I'm telling you, people are unconscious at nighttime to drink caffeine, but they don't rest as well if they weren't drinking caffeinated beverages, whether it's coffee or Coke or whatever it is, Mountain Dews. I can tell you right now, I've been there, done that. Caffeine does not help a lot of people. If you're driving a car across the desert, you're going to die because you fall asleep at the wheel, then you better have some. But otherwise, you're better off not to have it, as part of your problem, because it actually keeps you awake. As far as a well-balanced diet, you're absolutely right. Eating a reasonable amount of calories, trying to, working on the whole weight loss thing is important. People who are overweight if people who are overweight who have fibromyalgia actually lose weight, they've shown that their fibromyalgia pain scores go down. They actually feel better with weight loss. And weight loss actually has lots of other benefits too, as far as how you sleep and you're able to breathe better at nighttime. So nutrition, work on the weight, okay? And we've already talked about the sleep. What else is really important? Jan?
I was just going to mention, sometimes we forget that we need to have a full complement of our vitamins and our minerals, because we're depleted in our minerals.
Okay. So that'd be part of the nutrition. What else is, besides sleep and nutrition, is really important for people with fibromyalgia?
Well, maybe it goes with weight, but exercise.
Absolutely. Now exercise, you've got to be really careful, okay, because this is something I've learned by taking care of patients. I don't have fibromyalgia, but I've taken care of enough people that have it, that if people go off and start really aggressively with exercise, it just backfires on them. They just feel horrible, okay? So if you've not been exercising a lot, you usually have to start with about 10 to 20 minutes per day of just really moderate walking or whatever it is, okay? But it needs to be aerobic exercise, which just means things that you can do without losing your breath, okay? And so 10 to 20 minutes is what most people recommend you start at, and you need to work up to 30 to 60 minutes a day, and it needs to be every day. It needs to be something you kind of do religiously to keep yourself from falling down that spiral, okay? What else is really important, which probably is actually as important, if not more important, than this, is, as far as physical activity. There's stretching, okay? People with fibromyalgia need to go through a stretching routine on a daily basis, if not twice a day, if you want to reduce your pain and reduce your suffering, okay? And I'm not a physical therapist. We actually have some over here. And I think, if you find a physical therapist that has an interest in treating people with fibromyalgia syndrome, they can probably teach you some home stretching things to work on. It is not the same as, this is not like an athletic pre-football game stretch. It's much less intense than that, and it needs to work for you. So it's something you should work with a physical therapist or somebody that has expertise in that, okay? So stretching's important. And usually you want to do that 2 times a day. Okay, anything else? Yeah, Jan.
Education, so that you feel like you understand how to take self-management and some control back on your life.
I think it's really important for everybody that has this to understand as much as they can about it, because you have to be your own advocate. You really do. there is a lot of good things on the internet, and one that Jan referred me to before I came to talk to you, which I went and watched a YouTube video by a guy named Dr. Gross. And he's at the University of California, San Francisco, UCSF. And he's really a good speaker, number one. And number two, he clearly understands this illness very well. And if you want to go on YouTube videos and look up this guy, Dr. Gross from the, make sure you spell it right. So Dr. Gross from the University of California, San Francisco, I would highly recommend you do that. You'll learn a lot about your illness and be able to better understand what it is you're coping with. Anything else that's important besides nutrition, sleep, 10 to 20 minutes to 60 minutes of exercise, stretching, anything else? Yeah, Jen?
The psychological balance, understanding, I know it goes along with the stress management, but
yeah,
having ways to...
I think really, if you need to evaluate your lives and see, okay, where are the stressors in my life? Because if the stressors are not, if you're not dealing with your stress, you're not going to, this is never going to happen, okay? I don't think. I've been stressed out before where I couldn't sleep, like I already told you guys, and there's been other things in my life. Running for office has stressed me out. But sleeping is really important, and you have to be able to make that something you do on a regular basis. And I mean, every day for at least 8 hours. I think sleep hygiene is important. It's horrible. I tell you this, whether you got fibromyalgia or not, you need to go to bed about the same time every day and get up about the same time every day, and not do this crazy stuff where you stay up till 2 o'clock in the morning watching movies, then sleep until 10 o'clock in the morning the next day, and then you have to get up the following day and go to work at 6 a.m. That doesn't work. It just doesn't work. You have to try and go to bed at the same time and get up at the same time. So sleep hygiene is really important. Okay, so we got stretching, the psychological aspects of it, the stress management. Okay. And I think if you work on these kinds of things and educate yourself, I think what you'll find out is that if you be your own advocate and you learn as much as you can about this disease and understand how to manage it and take care of it, I think you'll be much better off. And your physician, you'll probably, my experience as a doc is that unless you have this disease yourself, unless it's all you do all day long, you're not going to know everything that your patients know about. That's just been my experience. I found out my patients oftentimes know more about than I did. And my job was to try and make sure we didn't put them on medications that would cause problems, or make sure the medications were working for them. That was kind of my experience in private practice. But anyway, I hope this has been helpful. I can speak for another, I can speak for about 30 minutes, but my 30 minutes are up. But I'm happy to answer any questions if you have any questions. Questions? Jan, you have anything else you want to say?
I want to thank Dr. Red. It's so hard to speak on fibromyalgia for just 30 minutes, 20 or 30 minutes. It is, you've done an excellent overview and to touch on the most important points. And so understanding that we're consistent in our recommendations. You talked about Dr. Strauss, what he recommended. Is it Gross? Okay. And I put it on Facebook wrong. Okay, I did misspell it on Facebook. But I think that the elements that you've outlined, I'm very appreciative of it, because that's exactly what the common recommendations are across the board. And as we know that fibromyalgia is not in the muscles and the ligaments and the joints, in the College of Rheumatology, it's actually more set to be a neurology field because it's a central nervous system illness, as you explained to us very clearly. And so I just want to thank you very much for coming. I know that Chantel's going to, she's on after ceremonies, but I wanted to, I don't have any questions right now. Does anybody else have any questions that they'd like to ask Dr. Fred? Thank you very much, Dr. Fred.
Oh, we have a perfect couple. Right there on the end. I can tell you guys are together. I know it. I've seen you on Facebook. Can you grab those two chairs and come on up here? This song just it needs people. A couple in particular works best. We've tried putting strangers together, and I don't know. It's kind of a mixed review. It just didn't work. Sometimes it does though, but one of them doesn't agree sometimes. So anyway, we're gonna do this next song. You'll love it. Right dead center where everybody can see you. You two are together, right? I knew. Just double checking. All right. This song is instructional for the guy. Do you know which one we're doing? All right.
Across the way, she don't got a lot to say, but there's something about her, and you don't know why, but you're dying to try. You wanna kiss the girl. Yes, you want her. Look at her, you know you do. It's possible she wants you to. There's one way to ask her. Don't take a word, not a single word. Go on and kiss the girl. La 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 la, my oh my. Look like the boy's too shy. Ain't gonna kiss the girl. La 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 la, ain't that sad? It ain't a shame, too bad. You gonna miss the girl. Found your moment, floating in a blue lagoon. All you gotta do is soon, the time will be better. She won't say a word, she won't say a word until you kiss the girl. La 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 la, my oh my, look like the boy's too shy, ain't gonna kiss the girl. La 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 la, ain't that sad, it ain't a shame, too bad, you gonna miss the girl.
He's thinking about it. Are you thinking about it at least? He's thinking about it. She's not going to talk to you until you do. You have to make the first move.
La 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 la, don't be scared. You got the mood prepared. Go on and kiss the girl. La 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 la, don't stop now. Don't try to hide it now. You wanna kiss the girl. La 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 la, float along and listen to the song. The song says kiss the girl. La 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 la, music play. Do what the music says. You gotta kiss the girl. You gotta kiss the girl. Go on and kiss the girl. Now would be good time. You wanna kiss the girl. Kiss the girl. Kiss the girl. Oh no, you can do better than that. Kiss the girl. Go on and kiss the girl. Oh, ain't that sad? Kiss the girl. Kiss the girl. Woo! Thank you.
How long have you guys been married?
Almost a year.
Almost a year. And he still needs help in the kissing department. I don't know. We're going to have to work on him a little bit more afterwards. Thanks so much for coming up, you guys. Woo! Fun.
Remember who said sometimes it lasts a lot, but sometimes it hurts instead. Yeah. Nothing compares, no worries or cares, regrets and mistakes, they are memories made. Who would have known how bittersweet this would taste? Never mind, I'll find someone like you. I wish nothing but the best for you too. Don't forget me, I beg.
Now, our healthcare providers have stuck with us, and we have Sherrick Peck, thank you very much, Sherrick Peck with us, and we have volunteer organizations that have come to help us today in the Sports Authority, and we have our wonderful sponsors who have donated behind the scenes and in front of the scenes and always to help us to bring awareness to fibromyalgia. Pfizer has been a supporter. We appreciate the donations that they give to us to be able to do this. Harris Preston and Chambers Law Firm, Lovell Studios, you see all this amazing equipment. Thank you, Matt. We appreciate your support very much. And we are excited to have the people who've come with you today to sing for us. And the Men's Warehouse has been a strong supporter. Thank you, Chantel. Excuse me, Fibro Innovations with Dr. Corey Kingston, Alpha Graphics, Peterson Wellness, the Sports Academy, Panda Express, Lee's Market, Macy's, Sam's Club, Chili's, Camp Chef, and Cache Valley Countertops. And I'm mentioning them right now, but they deserve more than just a quick mention. But let's give them a hand of applause.
And I see them bloom, and I think of you, and I think